The following presentation is presented and shown by the World Veterinary Organization for Dog Kinematics, Kinematically Controlled Neuropedics, Neurology and Rehabilitation. Founder and Board President Dr. Patrick Blattler-Monnier. Nero, Dutch Shepherd, male, 2 years old, has a severe lameness front left since 12 weeks. In my surgery, he went through the structural and functional orthopedic examination, X-rays and sonography, as well as a functional analysis of the locomotion. He also went through a CT as well as an anatomy of the biceps tendon. Nero shows a moderate degree of limb paralysis in the front left with a clear relief to the right. In the sitting position it shows a shoulder tip and a clear relief posture. The weight is shifted to the right half of the body. The hindquarters are very stiff. Nero shows a clear pace locomotion and the tail corrects the lameness by consistent and circular movement on the right axis of the body. In the video, 6 weeks after the tenotomy of the biceps tendon, no lameness is visible, but the left shoulder limb is not fully expansive and still shows a deficiency and overloaded on the right half of the body. A sonography in the cross-section of the biceps tendon can be seen in this picture. A clear filling, inflammation of the bursa is clear and marked with the red arrow. Same setting of the sonography cross-section of the biceps tendon 6 weeks after the tenotomy. The inflammation of the bursa has healed, is gone. In the next slide you can see the following X-rays. Elbow left side view, the joint as well as the radius and ulna look unremarkable. No radiological evidence of elbow dysplasia. Elbow on the left in the AP illustration, no evidence of arthrosis. The medial aspect of the joint is also unremarkable and no evidence of a coronoid process. The left shoulder appears largely unremarkable radiologically. No evidence of osteoarthritis or OCD. A fine border of mineralization is only visible in the intertubercular sulcus. This was the reason for sonography. Nero was again examined orthopedically and kinematically 6 weeks after the surgery. The results of the orthopedic examination were practically normal. In terms of function, a reduced movement of the shoulder limb mass was found, as well as a slight relief on the left shoulder limb mass. The standing phase of the humerus left shoulder left limb mass was shortened. They are compensated for the right shoulder limb mass, humerus right and femur left and right. In this example, you can see the chronicity of the lameness very well, since the right hind limb makes the greatest compensation. In this slide, you can see the swinging phase. Here you can see the diametrical picture of the stance phase. The largest swing phase in the front left, as the left shoulder limb, still shows a relief and the right body axis is overloaded, and especially since the left shoulder limb does not show the fully grip. The relief posture is also manifested in the peak vertical force, the acceleration of the limb. Due to the relief position, the front left is also smaller, bearing less weight.